Okay, all right. Good morning, everybody. My name is Stephanie. I work over at the clinic and the TRICARE office. It's not a true TRICARE service center that closed down about 5 years ago, but I help with benefits. If you get a bill, I help with bills. And if you need your benefits explained to you, then I'm at that office for your assistance also. So if you have any TRICARE problems or troubles or anything like that, come over and see me. Just ask for Miss Stephanie. Everybody in the building knows me. And I'll sit down and help you out. Today, we've been asked to come over and talk about the Fed VIP program. It's going to be a pretty simple briefing for active military. Here's your piece of it. Your family is going to use United Concordia. So for you, there will be no changes. So your family will continue to be signed up with United Concordia, and their care will continue next year. It'll continue until you do something to cancel their enrollment. For retirees, Delta Dental is ending December 31st. And for you, you need to go online and choose from one of these 10 companies that have 15 different plans to see what would be the best choice for you and your family, or you and your spouse. And that needs to be completed by the 10th of December. And the other piece with the Fed VIP program is the eye exam coverage. For retirees, if you need, this is a program that is offered by OPM. OPM has opened their Fed VIP program to retirees and active duty service family members. And for active duty service family members, if your family desires additional eye insurance, that is open for you to voluntarily enroll in. It's just a little bit extra coverage. You don't have to, but like select your usual benefits are for every 2 years you get an eye exam downtown. You're not able to be seen in the MTF. Your family members must go downtown to get their eye exams every 2 years. If you have family members and everybody needs glasses in the family, this may be a program that you can enroll in so that they can get an eye exam every year. And this will help cover those costs for exams and the eyeglasses. And that's pretty much the wrap on the Fed VIP program. If you don't have it done by December 10th, there's been no talk of extending the enrollment period. But I'm wondering if any of you have any questions or anything I can answer for you. And it can be on Fed VIP, or it can be any issue with TRICARE. If you've heard some rumors out there, let me know. We'll try and put those to rest. Yes, ma'am.
Yes, I have an alternate dental, but the eye exam, I just use TRICARE Prime. Is that going to change where I can't use TRICARE Prime to go get my annual exam?
Okay, the question was, can she use her TRICARE Prime to get an exam at the MTF? You can still be seen at the MTF under TRICARE Prime. The vision is going to apply to TRICARE Select members that only get benefits every 2 years for their annual exam.
Okay, this is a referral, so they can still give me a referral to get the eye exam downtown through the Yes, ma'am. If you need a referral to go downtown,
you will be sent downtown, and I'd like to also delineate the difference between a medical eye exam and a vision eye exam. If you are a select patient, for example, that has diabetes, your doctor will refer you downtown, and that will not be a vision exam. It will be a medical exam based on your diagnosis of diabetes. So that, I just want to make sure everybody understands there is a difference between vision and medical eye exams. Yes, ma'am.
So for the vision eye exam, can you explain a little bit of the benefits that if they opt in, right? Because with vision you have to opt in. Is there a cap on the benefits that you get for like glasses? Because that covers glasses as well, right? Not just the eye exam.
Yes, ma'am.
So our premium or our payment will go up, right, a little bit?
Mm-hmm.
But what exactly does that cover? Does that cover like one pair of glasses a year, one eye exam a year, or what exactly does that cover?
Based on my experience, because I enrolled in the vision and the dental when I became a civil service employee, I can go to the doctor, get my exam for a small $25 to $30 copay for the exam, and then I always pick out 2 pair of glasses, and it just depends on what glasses you pick within the plan whether you're going to pay any amount. So the basic coverage, it should cover most, if not all, of those glasses for you. But if you want to upgrade to a higher priced glass, then you would pay the difference of that. So does that answer your question?
Yeah, but it's once a year, right?
Yes, once a year. You would get an exam once a year, and I don't have to worry about using my select if it's the year it's my turn to go on TRICARE. I just walk in and I say, I've got vision insurance, give me an exam.
Okay. And it would be just like the medical where there's certain places downtown that we can go to for this?
Yes, ma'am. If you use this plan and you're in Wichita Falls, most if not all the eye places take this. Walmart, Haley Eye Care Center, Eye Express, Eye Mart. Those places all take these vision plans.
So it's just like any medical. You just have to call them and say, hey, do you take the TRICARE eye whatever plan? And they say yes, and you go in and
Yes.
they have to pay the above on the cutoff for the glasses.
Yes, and if you're concerned about what those costs are going to be, they can actually run your insurance information and tell you what your cost share or your copay will be before you set up that appointment, so you're prepared for it when you walk in. So
even for active duty, there's a copay?
no, not for active duty.
Okay.
Active duty family members and retirees.
Okay, so there is a copay for family members, for dependents?
Yes, dependents. Yes. Yes, sir.
So for active duty, the dental plan is not changing at all?
No, the dental plan, you are basically government property, so you have to get all your care through the MTF.
I mean for dependents.
For dependents, no, there's no change. No change for active duty dependents for dental.
Can you get an eye exam in one place, like say Haley's, and get your prescription glasses somewhere else?
Yes, you can. You can get your eye exam at one place, and you can get your glasses at another place. Do you have any other TRICARE questions? Yes, sir.
I have a question in regards to the Fed VIP, the dental carriers, the 10 carriers. Do they have offices in this region? Do any of these not have service in this area?
What's going to happen when you go online to search on this?
Yes.
You're going to put your zip code in, and it's going to give you the plans that are offered in this area. At that time, you can call your dentist, which I say is the easiest thing to do. Call your dentist and say, do you take this plan? Based upon that information, you could pick out what plan applies to you and purchase it. If you're going to move to another area, that would be a qualifying life event, and at that time you would be able to research another dental provider and buy it where your new living arrangements are made at. So if you move, you can change your plans, but if you don't, you're stuck with it for an entire year till the next open season.
Is there a way to, say, for example, if you don't have access to a computer or can't get online, is there any humans you can talk to or call somebody on the phone and get this going? Or?
I have it on good authority. These numbers are really difficult to get a hold of right now. I helped a gentleman that was 83 years old. He couldn't get through on his computer, so in my office, staying on hold with my cell phone and my phone, I was able to get him enrolled, pick a plan, and get him signed up within about 15 minutes. So the best way to do it is to get online and get enrolled. That's the best way to do it. And if you can get through, I've got a lot of complaints. It's very difficult to get through on these telephone numbers.
Do they give some type of a confirmation once the plan is approved so you know you have something?
Yes, sir. Yes, it'll give you a confirmation page that you can print out.
Mm-hmm. Then we receive cards in the mail or something? Or?
I'm going to assume they send you cards because they ask for your address, they ask for your information and stuff like that. So I would assume the cards would be forthcoming. But everything is triggered off your social security number. So if you go to, like I don't have dental cards right now, I go to my dentist, I give them my social security number, and my dental information populates, and they're able to settle my claims that way. So it's also, it keys off your social security number, this medical care.
Thank you.
Yes, ma'am.
So if you don't opt in for the ones that require action this December, the window's not going to open up again until next year?
Yes, ma'am.
It's annual. So if you don't opt in now and something happens for, let's say, the active duty for the eye exams, then you're on your own for this year. You have to go back and opt in next year.
Yes, ma'am. Yes, sir.
What is the annual re-enrollment period? Like, if you miss out, when would you be able to re-enroll?
It would be sometime next year in November. My extension, let me give you my phone number in case these are going out to the detachments. My phone number is 940-676-6194. If you get to the appointment line, they can forward you to me. For those of you that are in here and you just have something pop into your head, you can call the appointment line. They can route your call to me, and I can answer it from there. Do you have any other questions on TRICARE or any of the changes that are occurring, or cost shares, co-pays, urgent care questions?
All the copay info is listed on the website when you go to this?
Yes, for the dental,
Yes.
it will have, it'll come up with a package and tell you what the co-pays are for certain processes.
Services.
Okay, yes, ma'am.
Oh, urgent care. So it goes down from one urgent care that you could use in the area, right? And
Okay.
recently opened it back up.
Yes, recently we just got that fixed through DHA, and you are able to go to urgent care except for active duty. Active duty need a referral for everything. You don't need a referral to go to the emergency room, so if it's a true emergency, go. Don't hesitate. But for family members and retirees that are prime, you have unlimited urgent care at your popular clinics, Cal West, Clinics of North Texas, United Regional Physicians Group, and Community Med on Martin Luther King. Those have been opened up. Yes, sir.
I know for urgent care, you still have to call the TRICARE hotline to get authority unless it's non-emergency, but you want to see urgent care, that's okay.
Yes, if you have an urgent care issue and you don't want to go to the emergency room, by all means, use the urgent care system. If you happen to not be able to get a referral, I'm the lady you talk to when you get that bill, because you will get a bill. And what I do is you bring that to my office and I put in a backdated referral so that that care can be covered. We encourage those who are going to urgent care that are active duty to get a referral, but I understand that sometimes we can't see patients and everybody's knocked off to go to urgent care. Please make sure you get your urgent care, you get your medical care, and you follow up with your primary care provider afterwards. But if you do get a bill, I'm the lady that takes care of it.
Is that just for active duty, or do retirees, you say retirees have to also get a referral?
No.
for urgent care? No.
Retirees do not have to get a referral. They have released the urgent care program. Last year it was 2 visits. This year is unlimited. And they have fixed the urgent care issue for the clinics that were not really coded as urgent care clinics in the town. So everything's back to normal.
Would your dependents need referrals the same way that we would on active duty?
No.
Or they just go as well?
They can just go. They can go. Yes, sir.
So if TRICARE Prime, active duty dependents, and TRICARE Young Adult, they have to have the dental and vision.
TRICARE Young Adult would need the dental plan. But you're asking for active duty family members. They would use United Concordia, which is the current,
So even for young adults, they would still use United Concordia.
yes. So if you're on the young adult program and your family is enrolled to the United Concordia program, they would fall under that United Concordia program until they became uneligible for TRICARE. Yes, sir.
Do we have to enroll for the dental or United Concordia, or is that if they're on it now, are they willing to stay on it?
If you're on it now, if you're enrolled in United Concordia now, you will remain enrolled. There will be no stop in your coverage. There will be no change in your coverage. Okay, anything else?
Any more questions? No, everybody's got all the answers they need.
Okay,
We'd really like to thank you for coming out.
well, you're welcome.
If you don't have anything